Welcome to MD-Esti Besties, and we're here today to talk about something. We actually had a different topic that we were going to cover today, and this has been the week of people asking us questions about timing. So not only timing about making career shifts or anything like that, but timing about when are things too early? Oh, I'm too old. It's too late. I came in today for a full face of filler and I've got a wedding this weekend, all those sorts of things. And so we decided that we would take today and maybe have a little bit of a discussion about timing. And also it was time for Tracy's Sculptra. And so we did a little Sculptra yesterday, and we got a little bruising. I'm sorry.
Well, it's usually worse. I usually look like I have grape jelly all over my face.
Well, it's just you.
It's me. It's not the injector.
Don't tell everybody.
It's not
everybody gets that.
No,
bruising.
No, not the injector. It's me.
I love you. So I'm sorry. I know. It'll heal quickly. But anyway, so I just thought it was
worth it.
We would just say what that was before we went on with anything. Oh, I know. Okay. So one of the things that I think, we get a lot of questions about people coming in and asking, is it too late for me to start Botox? Is it long gone? Is my skin too bad? I should just forget it. This is really bugging me, but I should just live with it. And so let's just kind of start in that kind of place for a minute. And I think sometimes our mature patients who come in, this is just the way that it is because I've aged and I don't think there's anything for me to do. Let's start there and let me hear your emotional response to that. And then maybe how you would talk to a patient like that.
So I have several ladies and men, but several ladies that have come to me and that's their thing.
Yeah.
They never washed their face.
Oh my gosh. It is amazing.
Yes.
How many people don't wash their face.
I know.
What do you guys do?
And I don't kick them out. I just educate them. But I had one in particular and she came to me and she's been seeing me since I started. So she wasn't washing her face.
Yeah.
And she was like, well, it's just too late because, I'm already in my late 50s. And I was like, it's never too late. And it really is never too late. So what I started with her is a calendar. And I said, okay, in between your facials with me, because she wanted to set up and start doing that. That was her step in. Mm-hmm. And then we would, further down the road, we'd start discussing other things that she could do. I gave her a calendar. And I said, on this calendar, when you come back and see me in 4 weeks, I want to see how many days you washed your face. It's just like a little challenge. Mm-hmm. She probably had 15 days out of the 30. I said, it's better than what you did the month before. Mm-hmm. Now this lady is on a skincare regimen, washes that face every day and night. I've got her doing Botox now with Dr. Neiman, laser, microneedling. Mm-hmm. Her skin's never looked better. And she even said last week when she was in, I've looked back at pictures and I feel like a different person. Mm-hmm. And it's just simple things that they just don't know. And they start doing and they notice that difference. And then that confidence goes up and they're hooked. And I do tell people, once you start Botox, you're hooked. You're going to want it all the time. So, and she said, yeah, it's very addicting.
It does make such a big difference. It's one of the treatments that I really like to start with. And the reason I like to start with it is because you can see those results pretty quickly. Mm-hmm. And you get that brightening and that kind of that liftedness. And I know people sometimes have in their mind what bad Botox looks like. And they're worried about looking frozen, emotionless, their eyebrows doing crazy wickety whack things all over their face and just not feeling like themselves. And really, Botox that's well done should really just look like a very polished version of yourself with a very pleasant expression. And it should look very beautiful and balanced. And being able to have that and feel refreshed that way is really, I think it is uplifting.
Absolutely.
And the other thing that I really love about Botox is, and I noticed this the first time, I'll say I was really reluctant to get Botox before. I had filler a little bit before I had Botox. Coming from my background in anesthesia, I just kind of thought of Botox a little like a medicine that we use to kind of get people off to sleep called succinylcholine. And just the mechanism is overlaps enough that I was like, ooh, like, I don't know that I want to use that. And I, the very first time I had a treatment, I remember I was living a little bit more in my anesthesia life. And when I was there, I noticed that I felt like just a smidgen less stressed. And I was like, this is interesting. So then I kind of started digging around in the literature, and there's actually a number of studies that look at mood, especially people with a history of anxiety and depression, and looking at the change in mood. And there is actually an improvement reported by the patients who have had an aesthetic treatment of Botox on their forehead, an improvement in their depression and a reduction in the amount of anxiety that they feel. And so my hope is,
I love
yeah,
that.
no, my hope is that over time, that some more widespread use to treat people with mood disorders, because we know that there's actually an improvement in mood, and that's borne out. And there's small scale studies, so I'm sure we need a much larger scale study in order to really investigate that more fully. But I think it has a lot to do with biofeedback, right? Like if you're making that face like you're upset about something,
Yes.
Or you're worried about something, you keep giving your brain those signals back to your brain that there's something to worry about or something to be upset about, right? And so as you give your brain those signals, you reinforce that mood. But when you can kind of short circuit that with that biofeedback, it seems to help. So I think those are really,
Yeah, I love
that's
that.
a really interesting just nugget about Botox.
I learn something new every day from this woman.
So it's just one of those interesting things. But I agree with you. I just think that there are some things like biostimulators that we are going to ask a cell in your body, a fibroblast, to maybe turn on and upregulate and do a little bit more work. So a little bit more of the heavy lifting. And so I can say with confidence that most 30-year-olds versus like a 60 or 70-year-old, that cell is probably going to do a little more heavy lifting in someone who's got a little bit more youth on their side. But that doesn't mean that cell's not going to work at all. We just have to have realistic expectations.
Right,
And I think we can always have those conversations with patients about options, risks, and benefits, and just make sure that we are choosing things. But I can think of, and you know who I'm thinking of, but we've got a patient who is not 30. She is nearly 70. And we chose, she did not want to do any filler.
Yes.
But really had a lot of what I would call like kind of accordion lines, those lines between her eyes coming up here, going down to her mouth. And just really, really was unhappy with those. And we were treating her with skincare, and we were treating her with some other things. And we ended up trying some Sculptra, and it worked so beautifully. And so I don't think there's an age where the answer is no. There's just really knowing your options, risks, and benefits, and making sure that we are making good choices for you with your medical concerns, with your medical history, and trying to get you the best results.
Yes. Yeah, absolutely.
And she's so happy.
We love that.
Right? I do think there's too young, though.
Oh, yeah, for Sculptra? Or
In general. So we know that our FDA approvals for our filler and for our neurotoxin is 21. And I do have some patients that for one reason or another, like for a medical reason, that I've treated under 21. But there's another specific medical reason. I've got, I will say this, I've got a patient who's got some scarring, and we've worked in conjunction with her other physicians, and we've done just a little work with filler in the area of the scar. And she is under 21, but that's a very specific thing. I would never electively change anyone's appearance or electively treat anyone with Botox earlier than that.
So what do you think about the pageant girls? You know, sometimes they start very young.
You know, it's not, I don't have a lot of patients. That's a great question. I don't have a lot of patients that really fit into that lightly. And I think in general, I have a little bit more of a natural aesthetic, and somebody who's like under 18, I really want to see their full smile. I really want to see their full dynamic lines on their face. And I understand that that's a different world, but I still would hold fast to those FDA rules in that, because it's not otherwise medically indicated. So for me, I feel like for me personally as a provider, there is a too young.
Okay.
But when people get into their 20s and they start talking about Botox, I'm not going to lie to you. I have patients in their early 20s that have more deep lines and wrinkles on their forehead than some patients who maybe have never done Botox but are in their 40s or 50s. And that's just because their particular muscles are really pulling on their, really pulling, and they're causing those deep lines to form. And if that's the case, I mean, get in there and start treating earlier, so that they don't become deep static lines that you hate later on in life. So once you are kind of, in my mind, once you're over 21 and you want to make those decisions, you need to talk to your provider about that. And I don't think there's a wrong age. Hot take, though. I do not believe in baby Botox.
Okay.
I think that's hoo-ha.
Yeah.
And there are people who will do like little teeny tiny doses of Botox. And what I think is, you're under-treating somebody. You're going to give them a very short duration of action of Botox. They're either going to go, oh, that didn't work. It didn't work very long. With my patients who are young and we're doing some prevention or prejuvenation, I would rather give them a full dose and see them twice a year, see them once a year, but give them a full dose and have it last as long as possible. So I'd like to see those patients less frequently, but give them an actual treatment. So if you're going in and someone says, I've done your whole upper face with like 16 units of Botox, that's not a thing.
Right.
I don't even know what someone's treating when they say things like that. So it does require appropriate dosing. I would just spread out how frequently you get it. But I am not a believer. I know there are people who talk about it out there. 100,000% not a believer. I don't think it's worth your money.
And I've been in the room with you before when someone will say, I just want to treat this. But then you start talking about, well, it all works together. And then you educate them to understand. And then they end up with a full face.
Well, yes. No, there are certain things. Yeah, no, there are certain things that make sense to do together. A lot of times, and where I really want to steer people in the right direction is if they are just concerned about forehead lines and they come in and they just want to treat that frontalis or the muscle on the forehead. And if you treat that muscle in isolation, it's the only thing that lifts the eyebrows. And if you treat that muscle in isolation, then all the things that pull down are unopposed. And so you're going to end up looking like an angry bird, or you're going to end up looking like you've got a really heavy brow, or you feel really sleepy or something, because those depressors now are going to take over and fully take charge. And so that is one of those things that it's my job to say, yes, I hear you, but let me explain how things work together. Now, if someone wanted to come in and they just wanted to treat glabella and maybe get a little brow lift in isolation, great, we can do that. That's safe, because all we're going to do is treat the depressor, so you're going to get a nice elevation, and we can come around to treating the frontalis a different time. That's not going to lead to an unbalanced outcome. So it's my job, as people are learning about Botox, when we sit in the room, we want to have a discussion about it, and we want to have an open discussion and an educational discussion so you understand how it works, how it's going to work on you. And for me, I just always want the patients to have an expectation that's in alignment with what we can actually do.
Sure. And I've had patients that'll say, I don't want to be frozen. And I'm like, what? Freeze me. And I'll say, Dr. Neiman's your girl, because, you are more about natural and, if that's what they're wanting. I said, but if you want frozen, you go in there and you tell her you want a Tracy tox, and she'll know exactly what you mean. But yes.
Yeah, no, I think I do like to, but I think, I don't even know if I would use the word like frozen or like light or anything like that. I want to see a balanced result. So what I mean by that is I don't want someone to walk by you and go like, oh my God, Botox. Like
I'd be like, yes, I did. Yes, I did.
I want that to look balanced and fresh and well rested and all of those things. And sometimes that comes with having more of a full face or holistic approach. that's not right where my young patients, that's not necessarily where I start.
Yeah.
But I do want them still to have a balanced result with an appropriate duration, and I want to see you as infrequently as possible.
Yes.
And when that's the case, I think those patients are going to believe that I'm in it for the long haul with them. I don't want to see you back here every 6 weeks getting a touch up of your baby Botox because it wore off. Like, that's not valuable to the patients, and that's going to cause problems later on.
And they respect you for that too. And that's why I love you as a provider as well. Yeah. It's so sweet. I can be.
Oh my gosh. Alrighty. We're going to move on because otherwise I feel like I can get caught in that for so long. We're going to talk a little bit about the patients who show up. You guys, I've had patients come in my room and they've booked an appointment to have a full face of filler or Sculptra or something. And they have family photos that weekend, or they're going on a trip, or they're doing something else. And listen, I try so hard every time, but I mean, I love you.
Yeah.
And I gave you a bruise on your chin, and we didn't mean to, but that's just part of the process.
Yeah.
So let's talk. So in this act of It's All About Time, I want you to tell me about even some of your procedures, even starting new skincare or starting retinol or starting these ZO regimens. This is not like, we're not playing in our practice. We want you to get a result, but that means that sometimes there's a little downtime.
Yes. And the anticipated reaction that you're going to get, because if they're not on a medical grade skin product, if they're just using over the counter, and I'm not dismissing that at all, if that's what they are comfortable with. But then when they come here and they want to get on a new regimen, you can't do it before a big event or before a wedding. I want you seeing me a year, if not more, prior to that.
At least 6 months if it's like for an event. But just because I think, like, we use the phrase anticipated reaction. Tell anyone who's watching, what is an anticipated reaction with ZO skincare specifically? Because we talk about that a lot, particularly with ZO.
Yeah. So it's where you're trying to get your pH balance to where it needs to be. So you're not used to using these particular products, then your skin could have breakouts. You could have, and 9 chances out of 10, you're going to. And there have been times where I don't do it anymore because we have a new system, but I would give people my phone number and I'd say, text me if you're ready to jump off the ledge.
Right.
Because you're having some kind of, and it could just be a basic program.
Right.
Just 4 products. But certain ingredients are causing their skin to react like, what is going on?
Well, it's to stimulate the skin. It's to stimulate skin cell turnover. It's to stimulate the dermal layer of the skin and all the activity that happens there. And when that happens, you're going to get redness or flaking or irritation, and the amount of redness that people get really, really varies. And it can be a little distressing if you have something in your life that you need to show up for, and you're trying to look your best. And so you're starting new skincare to look your best. And then you have an anticipated reaction, and an anticipated reaction, like, when you're getting on ZO skincare, even if you stop the skincare, Tracy, it's how long does it take the anticipated reaction to kind of
about 6 weeks? Yeah, 6 weeks, if not more. Sometimes it's 12 weeks, but 6 weeks.
Yeah.
And I tell people, give me at least 6 weeks on this. At the end of the 6 weeks, if you're not happy, we'll pull back. We'll find something else, but give me the 6 weeks. And I had a patient yesterday who said, you were right. I said, what's that? No. And she said, and she stopped in a couple times and she was like, this is just not working. And I'm like, okay, but we're only on week 2.
Right. You're like, no, but it is working. And that's the reason you're here, because it is working.
I said, please, 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 just trust me. I've been through this. I know personally. I get it. I promise. She came in yesterday for a treatment and she said, I was so glad that you talked me through that. You listened to me. And I was like, because I knew what you were going to go through. I'm not going to put somebody on something or do a treatment that I haven't tried myself.
Exactly.
Because I want to know, so that I can explain, this is what you're going to go through.
Right.
100%. I'm going to tell you.
Right.
Or when they're doing a treatment, this is what you're going to feel. And they're like, wow, you hit that right. Well, yeah, because I know what it feels like. I'm not going to just throw you out into the wolves.
There is nothing on our shelves that we haven't absolutely vetted here. And as Tracy knows, I'm the most prone
Yes.
to have a reaction to products. And there have been products and the science behind them is amazing. And I know I'm an N of one, but if I can't get behind a product and say without a doubt, like you should try something, it's really hard for me to recommend that medical grade skincare to a patient when we have so many good options.
Yes.
And so,
And I think that that's what sets us apart too. We're not just, oh, use this because. No, tell me why. We tell them, and because we know we've tried them, we know ourselves.
right.
Just trust us. And I get it. Sometimes people, they do end up leaping, and then we just put them on something that's more calming. But
Exactly. No, but it takes time. And even for, I would say we always see patients who are getting ready for an event. And I always appreciate, me personally, having at least 6 months. So if you are a bride, if you are the mother of a bride, father of a bride, sister of a bride, you're getting ready for something, I always appreciate 6 months. And the reason why I appreciate 6 months, listen, whether you come here or go someplace else, let me tell you, you don't want to do Botox for the very first time right before your event. You want at least one practice round before that.
Yes.
Because sometimes when people are learning your muscles, they overestimate or underestimate something. And they need to do a little refinement, and it takes a minute. There are patients who've been with me for years, and I know exactly how their muscles are going to respond to something. And then when a patient comes in for the first time, I always tell them, I'm going to make the best educated guess. I'm going to try to knock it out of the park for you, but I may need to do a refinement. And then the more I work with you, the more I'm going to be able to just nail it to exactly your liking every single time I see you.
Yes.
So you want to have at least one practice round. And so depending on what neuromodulator your practitioner uses, that's going to kick you back however many months. So you want that practice round. And then my recommendation is that you do your neurotoxin, like for the wedding, 4 weeks before the wedding date.
Yeah, that's right.
And so I'm going to talk wedding specific here because I think there are a lot of people planning for weddings.
Yes.
And the reason why I say 4 weeks, it takes, no matter what neuromodulator we're using, some of them will set up a little bit faster, but it takes to the 2 to 3 week mark for them to kind of reach their steady state and look the most natural. And also, if anyone needs a touch up, I'm going to make you wait until that 2 to 3 week mark so that we don't overshoot in a different direction. So that is something, that time is important. But if we need to add a little refinement, you still need time for that to do its work. So 4 weeks is ideal. But if you're coming in the day before or the week before, it's not going to be its most beautiful for your event.
Yes.
And if you're coming in the day before, it's not going to be its most beautiful. It may or may not, depending on the neurotoxin that we use. You may or may not having some initial response to it, but it's not going to be your most beautiful. And we can't guarantee that there's not usually with neurotoxin, I don't get very much bruising, but sometimes there's a teeny tiny little bruise that crops up. And so you don't want that right before your event. So 4 weeks ahead, without a doubt, for your neurotoxin. And then another really popular treatment before someone has a wedding, I'm going to say one of two things: microneedling with a skin pen or a hydrofacial. Now, here's the thing. Microneedling with a skin pen and a hydrofacial, typically, most patients heal very quickly. There's very little downtime. Their skin looks glowing and beautiful the next day. But I don't think that's something you should do for the first time right before a wedding. Go.
I agree. And that's why I like you 6 months, great. I like a year. And most brides, they're already planning that out.
Yeah.
I'll say, when you're getting married, 2027.
I love our calendar. We do a calendar.
Yes.
When anyone's planning an event, and we'll write down their event date and we'll work backward. We'll march it out backwards. And it's funny because sometimes someone will have how many appointments on the books over the next year.
Oh yeah.
Just to get all of those things in and stay on track with their schedule. So
Yeah, and we'll write those.
I interrupted.
No, we'll write those down and like back and forth. It's like, okay, so you're going to see Dr. Neiman for this. You're going to see me for this. Sometimes it's 2 appointments a month, but it's something monthly, and it just gives them time to really appreciate, get everything. They want to be beautiful on their day. Who doesn't?
Who doesn't?
Who doesn't want to be? So
It's a big deal.
it is a huge deal. Yeah. And for the mothers of the brides too, I feel like
big
too.
deal.
So they're also very excited to come in and start. And I do have quite a few of them. They come with their daughters, and we get them on this plan for the year with our calendar, and they stick to it. And then, sometimes after that, they might fall off because, the wedding's done, blah, blah. But most of them still come back because they want to continue
Yeah, they
what
really
they
good about them.
worked up to get, and then their day, and they just feel beautiful, and that couldn't make us any happier. That they feel that way, and to be a part of that.
I wanted to circle back to something else, which I think just for anybody who, so maybe not patient-centric, but anybody who owns or who is an injector or esthetician or something, I think that one of the things that if you can do this in your own practice, or if you are working in a practice like this, you have hit the gold mine. I think that one of the things that is really special, like when we're talking about the calendar or talking about timing, is that I always think of the people who come here as our patients.
Yes.
It's not my patient.
Yes.
It's not Tracy's patient. They are our patients.
Yes.
And there are things that are in my skill set and time management and schedule to do. And there are things in your skill set and time management and schedule and everything to do. And one of the things that I love about our approach to timing for patients is that, okay, we're going to do these things with me. And then I'm going to have you see Tracy for these things.
Yes.
And then you're going to come back to me. And Tracy is reinforcing, we're going to do these things together.
Yes.
And you're going to see, we're going to keep you on track on Dr. Neiman's schedule. And we're going to kind of go back and forth. And that handoff for the patient, at least I hope it feels seamless for the patients and that they feel well cared for. But also, I think it's amazing to work in an office and in an environment where I know that I can hand a patient off to you. You're going to take excellent care of her. And then you are going to, when like the things that she needs are out of your skill set, you're going to hand her back to me. And we're reinforcing that treatment plan with them the whole time. And we're all on board with getting them the best plan.
Yes.
And giving them the best result.
Yes. And I think too, like I had a patient, and she was new, and she came in for wanting some consultation. And I said, what you're wanting is not in my field. So I am going to send you to Dr. Neiman because this is what I suggest. And with estheticians and nurses, I believe too, you always have to get a good faith exam from either your PA or the MD, the doctor. So you were busy. I brought in Ashley, our PA, after I'd already discussed everything with this patient. Word for word, Ashley said everything I said. And I was like, that just shows we all work together. We're on the same page, and we want the same end goal. And I just love when that just comes together.
No, it's so collaborative. And I think that, and also I think that really respects the patient's time too, because as we work together as a team, and we have meetings here where we go over treatment plans for patients, and we make sure that we are discussing those shared patients in regards to their care. And I think that really, it comes through in the way that those patients know that we communicate with each other. We are on the same page. We come from a similar philosophy. And so we're all on the same script, right? We're talking from the same playbook, all of those metaphors that just say we're on the same team taking care of you. That's I don't know. I like that that's the way that we operate, and I like that for our patients. And so I hope people find a place to go where it feels like that.
Absolutely. And there will be times I'll ask a patient, they'll say they went and had this treatment. I'll say, where'd you have it done? I'm not asking because I want to take you from them. I want to know because I know I do my research, and I try to keep good relationships with spas. Like in Northern Virginia, in our area, I might know what they use because I'll say, do you know what laser they use? I don't know. Where'd you go? I'm not asking because I know what they use in their office. They respect that as well because then oh, she knows what she's talking about, you know, because we really do. We're constantly putting in the learning and, you know, just to the education.
Right. No, but I think that's an interesting thing. I think maybe we'll pick that up on that up different because that's a different conversation about collaborative work and all that. That's good. But I'm going to move us along to act.
So we could just go.
I know. I could keep talking to you forever. But one of the things that I run into again and again is people talking about like frequency of treatments, and they're looking for a one and done, or someone will come in and they'll be like, I just want the one laser that's going to clear up my last 25 years of sun damage. And can you do that for me? And I never want to come back and have that done again.
Yes.
And so how do you talk to patients, or how could you educate someone on the notion of one and done?
Well, I've been in those shoes to where I know, you know, like if I was a sun worshiper back in the day. I have so much pigment. If it was a one and done, I would have already had it done. You know, I would have been there, boom, check, done. There's no one and done. You know, you have to, you're going to see improvement after the first, but then you're going to want more. So I just say invest in yourself to do that, but just understand that it is a process. You're not going to walk out of here. You're going to be red when you walk out of here. Sometimes you look bloody. You're not, but you know, it's just,
well, there's healing.
Outcome.
There's healing.
Yes. And some people don't want that. So if you don't want the downtime, this certain procedure is not for you. Maybe we stick with just a basic facial, you know. But if you're targeting something, it's work, and you have to know there is the downtime. And we had a patient ask, well, what's the purpose if you're going to walk around red all the time? I said, well, we're not walking around red for it could be 2 weeks, but we're here for the outcome. So we're excited for that, you know, because you got to go through it to get to it.
Yeah.
And it's not a just one and done. And if it is, tell me, fine. I would love to know where it's at because I'll go. Yeah. And I did have a girl yesterday say, I got rid of some pigment. All she did, one treatment she used, and she did this, and it was all over. I said, what did she use? She said, I don't know. So where was it? It was someplace in a different state, so I didn't know. But I was like, I'll find out what she's talking about because I guarantee it's not a one and done. You know, so why even say, I just don't think that people should even promise that. Because, I mean, and if it's out there, then tell me.
Well, your skin is a large organ system, and it's going to respond to stress, hormones, sleep, nutrition, health, all the things, sun exposure.
Yes.
You know, if you had a couple of glasses of wine, you know, all of the things. And so your skin is always changing. And so the notion that you could even do a facelift and have it stay that result forever and ever is just it's not possible. And that's not a realistic expectation. And so I think it's just important that we start from that basic, like we know that this is going to be incremental. Incrementally, we want to see improvements. I also respect the fact that our patients are investing and they're spending, you know, hard-earned money. Absolutely. And I will use the phrase, in this economy, I mean, it's like, this is a luxury investment. And so I also understand that when you've spent your hard-earned money on something, like you want to see the results for as long as possible. And I understand that and respect that, but it is a process. And I can't change the fact that you will incrementally see those beautiful results emerge, but it's not something that's going to be done once and you will never, ever have to do it again. Now, I'm going to backtrack for a second and say, aside from Botox, which wears off and you need to repeat it, filler, some other things, you don't need to do those by the clock. Right. You need to do those based on changes that you see, whether that's bony reabsorption, you see some shadows on the face, you see some areas where you've had some volume loss, you've seen, you know, those like reflection, those highlight spots and the contour spots are changing, and you want someone to address those for you. That's different with and you know, I think that people really get themselves into trouble when they're like, well, so-and-so told me that my lip filler only lasts for 6 months. And so I've been going to get lip filler every 6 months for the last 7 years. And then they show up here and I'm like, ooh, like we need to make some correction here. Sure. So filler should not be done by the clock. That should be done based on an assessment, a diagnosis, and a treatment plan. But some other skin health things like lasers or things like even some of our biostimulators, there are guidelines for how close we can do those together. But your skin is going to change. Over the summer, you're going to have some more sun exposure. I always will tell people my basic plan: Sculptra yearly, Halo twice a year, Dysport every, 4.5 months for me because it usually lasts about that long. I know, I'm sorry. And then BBL whenever I can, just because I think that's a great
And I
for
told
me.
somebody today she would do it weekly if she could.
I mean, that's a little, like I would do it monthly if I could. I would do it monthly if I could.
Yes, yeah.
And I'm a super new convert to the skin pen. But my general thing is a Dysport every 4.5 months, Sculptra once a year, Halo twice a year, filler only when I feel like I need it. And I had some filler recently, but then it was like years before that I'd had any. And so I know that in the future, I'll still need to do some of those things. I look forward to doing my Halo procedure because I know my skin looks amazing afterwards. And so I know that that's part of the process and part of the maintenance. And I'm seeing the rewards of just kind of keeping up with those treatments as time has gone on. And I also don't feel like I look radically like a different person after any one of those treatments. It's just now maintenance. But the thing I think is confusing is that we are beauty adjacent. And so when you go into the hair salon and you get it and you get your style and color, you walk out of there and that's like the best your hair is ever going to look. Except for our friend Jackie, who like it's a curly girl cut and it's like wet and like she has to go home and let it dry. But for the vast majority of like my hair never looks more straight or like the perfect curl or wave or whatever when I leave the salon. We are not the salon.
Right.
We are a medical practice where you are going to have some time to heal in order to get those results. And you can't expect to walk out of these doors like you walk out of the salon with your hair blown out and perfectly done. This is a much, much different thing. But I think because of that adjacency, if is adjacency a word, because we're beauty adjacent, I think that sometimes people think, I'm going to walk in there and my lips are going to look exactly the way I want them to look afterwards. My cheek filler is going to look perfect. I can go from there to a photo shoot. And it is so mission critical that that's not your expectation, so that you give yourself the proper time to heal. And that you love your results and you're not stressed because you had something that was an important event that now you're stressed about because you feel like you don't look quite like yourself because you're in that healing phase.
So I wanted to add something, if that's okay.
100%.
So when I I love it. No, I could just sit here and listen to you all day. In my late 30s, I had a lower facelift. And I'm here to tell you, when I turn 55, I'm going to have a full facelift. That's not like you were saying, it's not a one and done either. And I think even back then I probably thought, oh, this is all I will have to do. No, I've had Sculptra is like my jam. And I do that every 6 months with you. So I've still had to put the maintenance into it as well, even after that 20 years later. And I've learned now that I wish if I could go back in time, I wouldn't have laid out in the sun with baby oil and all of that, and that's just what caused where I looked 10 years older than I was. But that's why I did it.
But you can't undo years of sun exposure with like one treatment. Someone can't come in here with hyperpigmentation and years of UV exposure damage to their skin, like with like glycation damage and things like that, and like bumpy skin around their mouth, and expect that we've got one treatment that's going to like make that go away, and then they're never going to have to do anything ever again.
Well, exactly, because on my arm, I got a full sleeve. Do you know why? I had sunspots. Now on my sleeve,
I didn't know that's why you got your full
my
sleeve.
sleeve it's got a statement. I know why. Like what everything has a purpose in it. It has a meaning, but I was tired of looking at the sunspots.
Yeah.
And so it just started here, and I just, whoop, okay, let's just do the full sleeve.
Mm-hmm.
I've got some here. I'm like, if they don't go away, I'm going to do the same. So, it's like,
Potentially here, are you going to make like a little like ode to me somewhere?
absolutely.
You're like, yeah.
It's just okay. Say Lynn Neiman.
Oh my gosh, thank you so much. Appreciate that. Okay.
So, yeah, I mean, you have to, and the expected time. I did an ablative CO2. I never thought I was going to walk out of there.
Did a fully ablative
Yeah.
CO2.
And I would be glad if you want to DM me and see the pictures. I will send them to you because it was crazy. But I knew that wasn't
That's not a one and done.
good grief. No, I look like Freddy Krueger, and that's for about 2 weeks.
That's the best visual. And when you
Yes,
say
it
Freddy
was-
Krueger, if
absolutely.
you're old enough to know who Freddy Krueger is, yeah.
So many.
Yeah.
But I knew that for 2 weeks I looked crazy, and then even up to a year, I was still healing from that. I love the results after. Would I do it again? Yes, but I'm not but when you're new to it, you don't understand. And, there was back in the day when I wasn't new to it and I was thinking, oh, that's all I need is and that's it.
Thing.
Yeah.
Thing.
But no, you have to keep that maintenance going, as we age, gravity.
Yeah.
So,
No, absolutely. And then let us move on just a little bit. Was that you?
it was me. So.
Okay, excellent. Let's talk about combination treatments. And let's also talk about, maybe let's talk about menus. When people come in and they're kind of like picking off a menu, why we make some recommendations the way that we do, and why it's really important. I never want a patient to ever feel like I am trying to sell them anything.
Absolutely. Yeah.
At the end of the day, what I do is make a diagnosis. And then from that diagnosis, I make a treatment plan. And then I share with you a treatment plan. And that treatment plan usually has 2 arms to it. One arm is going to be for a problem that you came in and we addressed and we're talking over. And the other arm is going to be just maintenance and overall skin health. So we're going to have those 2 arms to that plan, every single patient that comes in. What you choose to do is completely up to you. I'm going to help guide you through that to get you the best results. Or if there are things you're comfortable with, some patients will come in and say like, I don't ever want to do HA filler. I don't love that. I'm like, totally fine. Let's take that off the table.
Absolutely.
Let's talk about these other things that we can do. But I say that also to say, you can't do everything with Botox.
Yes.
I have patients who are older who they'll come in and they'll just say, they'll have lines up here, they'll have lines over on their cheeks, and they'll just say, can't you just fix those with Botox? And my answer is no, and they would talk about the other things that they could do, and a lot of the times they're like, that's okay, we'll just do the Botox.
Yes.
And so talk about how you talk to patients about combination treatments, about why it is that we would even recommend combination treatments in the beginning, because again, it's not to add to the cost. I understand how expensive it is for some of these treatments. Like I totally get it. And we try to do what we can to make things accessible. But it's just not, it's not only sometimes just a one and done, but it's not only a one tool from the toolbox.
Yes. Yes. And I think we do really good with that together too, because if they're coming to see me and they want microneedling.
Yeah.
So we'll go through, okay, what are your concerns? And let's just say wrinkles or, laxity. Skin pen, my analogy, skin pen or RF needling takes the dents out. Let's think of it as a car. Takes the dents out. And if you want to do an ultra on top of it, that's your clear coat. So they work hand in hand. Your skincare, foundation. But then you want to step it up. You don't want filler? I don't blame you. I'm telling you Sculptra. And then I'll even say, I'll use I promise you, Dr. Neiman's your girl. Go see her for that. And I'll say, because they'll say, I don't want it to look like I had something done. I'm telling you with Sculptra, it doesn't. You might have a little bit of swelling. I'll take all the swelling, but you might have some right after. But I tell them, people will never know that's what you had done. The first time I did it, it was like 2 weeks later. I forgot I did it, right? And somebody at the school said, something about you. Are you getting more sleep? And I was like, yeah, that's what it is. Wouldn't we all love that? And I was like, oh, it must be my sculpture kicking in.
Yeah.
So I think they all go hand in hand. They all work together. Botox, yes. Neurotoxin, all day, every day, right? It goes with all of it. But for those who are looking for the volume, but they don't want the filler, or they don't, they want to do the microneedling, but they don't want filler, but they still want that something.
Yeah.
Then I think the combination, I'll talk about Sculptra. Radiesse, you do such a fantastic job with snatching somebody's jaw with Radiesse. It's fantastic. So those are things that I'm like, if you're just wanting that little bit, you're not going to get it from this, but you're going to get it from this. And they all work together. And everything that you're talking about, it's targeting. Laxity of skin, wrinkles. If you're talking about pigment, boom, we just covered that with microneedling ultra or BBL Moxie.
Right.
And then if they don't want filler, but they want some volume, hey, she's got you, Sculptra and Radiesse. And I can speak to it because it's what I have done. So that goes back to, I'm not going to steer you in the wrong direction. I'm going to tell you because I know it works. But I think all the modalities just working together,
right,
you're going to see such a huge difference.
Yeah.
In the skin quality and everything. I
think so too. And we use, I know you've heard me say this a million times, so I know boring to you, but to anyone who may want to know, I have this analogy of a cake that we talk about, face cake.
It's fantastic.
And if you think about your face like a layer cake, our bone is like the little cake stand that everything sits on. The first layer of the cake is anatomically a deep fat pad layer. The second layer of the cake is our muscular layer, our SMAS layer. The upper layer is a superficial fat pad layer, and then that beautiful fondant icing over the top would be like our skin. And so there is no one product that we have out there that treats all of those layers. Yes. And so that is why when I say diagnosis, I'm trying to figure out which layer of the cake did not bake well, or isn't baked well right now. And let's fix that layer of the cake. But sometimes there's more than one layer that we need to address. And so I'm going to pull different tools from my toolbox in order to treat what we've diagnosed, right? And so in order to make those layers look like big, beautiful, even puffy layers of the cake, or maybe make that icing look nice and smooth and those sorts of things. So that's why sometimes one treatment is not going to fix everything. We have to choose different things. But I will look a patient in the eye and say, I'm here all the time. If today's like, we laid out our treatment plan. If you need to think about this, if you need to start here, and even though you know that we would maybe like to do a couple of these things, combination of these treatments together, I'm here all the time. You can come back and see me a different time, or you can think about it. We can put these things together. If it's a budget thing, we can talk about it. If I'm comfortable with it, we can talk about it. And sometimes as patients get to know me better, they get to know you better, they get to know the whole office better, and they feel really welcome and comfortable here, then they start feeling more comfortable doing those combination treatments. But I would encourage you, if you are a person who's investing for the long term and you're hoping to get to your 50s, 60s, 70s feeling like your best version of yourself, I would say think about doing more than just Botox. Talk to a trusted provider, come up with a plan. And then sometimes you have to step out of your comfort zone a little bit in order to get the best return on your investment that you've made, so that you have results that look really normal. Again, sometimes really focusing on one tool though doesn't look normal over time.
Of course, yes.
It kind of looks like maybe something's off if you only do that one thing over time. So that's why I think we're very holistic. We're looking at all the layers.
Yes, all the time. And when you talk about the cake, even when we had that one, we had a night where people came out and we just did, like you were talking to them, educating them. And when you did the cake, I mean, everybody was like, wow, that all makes sense. So it's just, I think the way you made that and just the analogy of it, I'm saying I use a car as mine, but everybody was like, that makes so much sense.
It really helps to like visualize those things, because I've been fortunate enough to take how many anatomy courses and do dissection courses back in medical school, but then do a number of different dissection courses just when I've been doing injectables. And so like, I feel like I get it. Like I understand the layers. I understand the way that anatomy works together on the face, and I'm at an advantage because I get it and I know it, and intuitively it makes sense to me, but it's my job to explain that to a patient because I want someone to feel like we are holding hands on our journey and I'm not like dragging them along. Like we're skipping along together because we both understand where we're going.
Right.
And I'm not just taking someone there and they're like, what?
Right.
Like, what are we doing? Or why are we doing this?
Yeah.
I want you to know, which is why I always tell people, I always talk a lot in our initial consultation because I really do. I want people to be like teammates on that journey.
Yes. Yeah. And that's what I say to them as well. I'm like, I can't wait to be on this journey with you.
Yeah.
It's going to be great.
It's so exciting.
It is.
It's so exciting.
Yeah.
So in like wrap up, just thinking about timing, what are your like best pearls of advice you would give to a patient, a listener, maybe even an injector or someone who's just starting off like an esthetician? Like think about like what advice would you give to help people just get some good habits in about timing for results?
I think you covered a lot of that. It's fantastic. Are we talking about like an event? Or if we're talking about an event, I mean, I know you say in your
area, 6 months. I'd love 6 months. Yeah.
I like a year. And estheticians that are out there working in other practices or coming up, you have to work with your team building this together. Because I like how you said, it's not just my patient, but we're sharing the patient. And I love that we can be upfront and honest with them. And I will look at something, no, ma'am, you're not getting that before your wedding, 2 days before your wedding. It's just, I'm not doing that. I'm not afraid to say no. But I think the time, if you want injections and you're going to go on a trip this weekend, no, you got to give yourself time for the healing process. And I always say, start with those consultations with us. Let's go over the expectation you're thinking, and then we'll say, I'm gonna give you the expectation of what you're actually looking at, because they don't know. They're coming to us for that advice.
Right.
So I always do not do it before a weekend event that you have going on. And my brides, I like a year, if possible. I'll work with what I can. But I really like that because, and I feel like brides, when they're planning that first wedding, they really are on top of it. I've got some that are like, everything will be fine. Then I've got some that's like, I got this. So I say, with anything, at least, even if you're going to start skincare for the first time, I mean, give me 12 weeks, at least the 3 months, because you're going to have anticipated reactions, or if you're getting injections, you may have a bruise. If you laser, you can't walk out of here looking bloody and then expect tomorrow to get on a flight and go to California or something,
Right.
So I'd like for them to know, like, come to a consultation and let's talk what you're looking for, and then we can get it into realistic of what your time frame is and what it's going to look like.
Got it. No, that's good.
Yeah.
I
That
think
too.
my, unless there's a medical reason, an important medical reason that tells me that someone younger would benefit both physically and psychologically from an intervention from me, 21 is typically my young. I say you're never too old.
Yeah. Never.
And you're never too old. There's something that we can do in a treatment plan that we can arrange and provide for you that I think that would be appropriate. I always tell my patient, it's taken you, especially people who are here for the first time, it's taken you X number of years. It's taken you 34 years, 45 years, 53 years, 72 years to get here. I can't make that all go away in one treatment.
Yes.
So expect that results are incremental and happen over time.
Yes.
And expect us to partner in a plan, but that there will be a plan and there will be maintenance. Absolutely. Don't expect any one and dones. And we're not the same as the hair salon.
Right.
I want you to be able, especially with some filler treatments, I want you to be able to look in the mirror and love the result that you see, but it's not done.
Yes.
It takes a minute to settle. It takes a little while to heal and for it to look its best. So you're not going to have the glossiest, shiniest, bounciest curls that are like a fresh blowout or anything like that. You are going to heal.
Unless you're Jackie.
And because you're doing, because we are doing a medical procedure.
Yes,
So you see my analogy. It's not the same.
Yeah, that's a great analogy.
And so you have to accept that when you come here, you're going to get a hint at your result, but it still has to settle. And that result is going to come over a little bit of time.
Well, you can't go into the salon and be a brunette and say, I want to be blonde just like that.
No, you
not gonna
can't do that.
happen,
No,
so-
you can't do that. You gotta be in stages. Vacation thing, I'm of like a different, it depends on your vacation. Because I do have patients that like to come in and get injectables like shortly before they're going to go on vacation, because if they do have some bruising or healing, they'd rather do that not around their friends and people with like prying eyeballs in town. They'd rather do that on the beach somewhere.
Right.
And so as long as we're like in a place where we're safe, and all of my patients get instructions for traveling and things like that. But and when it's safe to do things before getting on a plane. But that being said, I think I'm like a little bit different as far as you go there because of some patients' preferences for their healing and downtime. And then I think also just understand that I will never ever, it's like a promise I have with my patients, I will never ever try to sell you anything.
Yes.
And if you are in a situation, or if you're in a medical aesthetics practice and you feel that, just know I am always coming from a place of, I want you to know what your options are, what your options to get your best outcome, maybe a good outcome.
Yes.
You know, and then we can always start small and build. And that my priority at the end of the day, and I think you can vouch for this, is at the end of the day, I want patients to feel like I feel great.
Yes.
I feel seen. I feel heard. I feel like I'm like, this is the best version of me. I feel awake. I feel vital. I feel like all of the things.
Yes.
We want our patients to just feel pretty, like they're pretty selves, right?
Yes.
And so we are in it with you, and we want, again, hold hands with you, same team, running, in the same direction. And we want you to feel that way. And so when we do tell you that things are going to take time, or that we're going to have to do more than one treatment, or it might take us a minute to get there, or I also say a lot, give me 6 months and we'll look at pictures 6 months from now, and we'll look at pictures now. And whenever I do that with patients and we look at pictures 6 months, they're like, oh, like I get it.
And they see themselves daily. So sometimes they're not noticing that change until you have that side by side. And you're like, wow, the wow factor sets in.
No, absolutely. That's absolutely, is that perception, that bias that you have, and that you see those incremental changes happening day after day. So they don't seem like a big deal. And then when you see, it's perception drift is is the name for that. It's like, that's your new normal. You wake up every day going, this is my new normal. And you forget what baseline was.
Yes.
And so it's important to see those photographs. But if you stick with the plan for a while, you will see that difference. We just need to sometimes give it some time.
Yep, absolutely.
Awesome. Well, Tracy, thanks for taking your time
It's fun
to talk about time. And then I think for our next podcast, maybe we'll get into some more meaty stuff about kind of our transitions and time and aesthetics. Sound good?
Sounds great. All right. Love you. Love you.